All right, so I do realize I'm a day or two behind, or three, on some videos. Um, so I'm going to amalgamate 3 days into one to be efficient. So, Mission Monday, Testimonial Tip Tuesday, and what's the question Wednesday? So, Monday, mission. Like the mission has always been, to help people with innovative things that they may not have had access to, mainly because the people that they're going to or the people around them have not been doing anything new and innovative. How that started for me was, many of you know, was a neck injury, a congenital issue that I had that I didn't know about, and spent a lot of time playing sports and doing other things that injured myself, and got to a point where nothing else was helping me, and I had to innovate myself into something that worked for me, and that's how we got involved with decompression. That's how we started noticing there were so many holes in healthcare for patients that just didn't have solutions. I've had patients come in that, the solution was actually fairly simple once they had somebody take a look and figure out exactly what it is and exactly what might actually work for them. So that's always been my mission as a doc, trying to use the knowledge that I have and maybe the somewhat eclectic knowledge that I have, to find solutions for people that nobody's ever found solutions for. In fact, just this week, I had a patient that came in with frozen shoulder. And it wasn't really frozen shoulder. It was more so a problem with their neck. And the doctor had said frozen shoulder. The funny thing is they could lift their arm. It didn't really seem like frozen shoulder. Once we looked into their neck, they had nerve compression in their neck. So we start treating them with decompression to try to take the pressure off that. And lo and behold, it did a pretty good job. Patient's feeling a lot better, and I think they're on their way to a good recovery. But it took some innovative thinking to actually go deep enough into that problem and figure out exactly what's going on, then apply the right solution for it. So if you're a patient, that's a very valuable thing to you. If you're a doctor, being able to have that knowledge, not only knowledge, but have the technology to be able to apply something different than what you've been able to apply previously, that's a huge thing to be able to do. So that's something that I can help both sides with. Our docs that have our tables, there's a lot of accessibility across North America now, for patients to get to a proper solution. And if there isn't something in your area, then we can always try to help find you a better solution regardless of where you are, because that's essentially what the mission is. So, testimonials, tips. Well, for docs and for patients, if you're struggling with something and you haven't found a solution, then try something different. Do something different. So I get patients that come to me all the time that have been to chiropractors, physios, massage, acupuncture, and they've all done reasonable facsimiles of the same thing. I always wanted to be different because that set my business apart from everybody else, and that set me apart from everybody else. It's not that I like to think I'm better at some things, but it's not really that I'm any better at anything. It's that I'm doing something some other people are not doing that offers a different solution for things that other people weren't able to get solutions for, just simply because we're applying a different way of thinking and a different mechanical way of doing these things. So as a patient, to try to get the results that you want to get, try something different. Don't be afraid to try something different, because trying the same old thing is not going to get you different results. That's that definition of insanity that comes in. As a doctor, if you're struggling with your business or struggling with patient results, by adding a new service, adding a different service, adding something that no one else can compete with is even better. Even adding a new service, we go kind of back to that. When things started to stagnate in my office, even before I started developing technology, I got a new piece of equipment, something that people might be more interested in, something that got a little bit of buzz in the office. More importantly, something that got results in a different way with different things than I was able to work on before. All started with lasers, and then it just sort of branched out from there. So right now we're doing neuropathy machines. We've developed a new neuropathy machine that we're deploying out to clinics. We have our robotic laser enhanced spinal decompression that does, again, different, not only back, not only knee or neck, but we do knees and hips as well. No other decompression system on the planet does that. Why did I develop that in there? Because for as a doctor, being able to treat more things that patients have more problems with, that's more reasons that a patient has to come to you. And most importantly, that's more things that you can help that patient with. And we all know that's good for everybody. That's good for the patient getting better. That's good for you as a doctor feeling that feeling you get when you don't have to tell the patient, I can't help you anymore. Or even better yet, well, 5 different people tried this on it. You're the 6th and you've tried that on it, and that's what actually worked. Being that person has the solution is huge, not only for you, not only for the patient, not only for the profession, but everybody involved. It's just a great feeling to be the one that comes up with the solution. And if we get right down deep into it, that's why almost all of us got into this thing in the first place, was to get better results, helping people. And now for me, I'm very happy that I'm able to help patients at the clinic and help my doctors that have my devices help patients, and help doctors that may have been struggling with their business because they weren't able to attract the amount of people that they could attract by just doing something different. And again, it's not all about, there's obviously a revenue generating component to that if you can attract more clients. But if you're the one that can, has a solution for that person with knee pain that the other person never had a solution for, or have a solution for that person with hip pain that was probably misdiagnosed as sciatica or something else, and you actually come up with that solution, that's great for the patient, that's great for their family, that's great for everybody they come into contact with, because they have a solution. They found a solution in you, and they're going to tell everybody about it as well. So third part, what's the question? Well, how do you accomplish all this as a patient? Well, simple. You seek out things that are different. You have to do a little research on your own, or by all means, if you're accessible to our clinics, you come in and try what we have to offer. If you're not accessible to our clinics, you can always contact us as well. Well, many times we've found patients solutions that are close to them that may be different than what they have had access to or tried before. And that's just done as a service because, again, the mission is to help. So as a doctor, if you're looking to do something different in your practice, we probably have that solution for you. Not just probably, even if you're a decompression doctor already and you want to upgrade the technology that you have and add robotic laser to it, or if you have you've not done neuropathy. Neuropathy is a huge niche right now, mainly because a lot of the patients that we get for neuropathy, I've got foot pain, but I don't realize it's related to my back. So if you put a back ad out, or you say, I treat backs, I help backs, the person with foot pain is not going to notice. They're not going to know that their foot pain is coming from their back. They're going to think that's a problem with their feet. So if you don't tell them that you work on feet or that you can help with feet, that person's never going to get attracted to what it is you have to do, or what it is you do. Losing the English here. It's the only language I got, so I don't know what I'm going to do after I lose it. So I get a lot of patients in for our neuropathy system that we find is actually a back problem. So we'll assess and we'll look at it. Well, this could be partly coming from your back. So we'll try this treatment, we'll try that treatment. We have access to different things, and lo and behold, we end up finding the solution for them. So if you're a doctor struggling business-wise and you want to add a neuropathy niche and a decompression niche in combination, that is huge right now. And we have the way to do that. We have actually a scaled system where we introduce the neuropathy niche, which is easily deployable, small amount of equipment that we provide, and you start doing neuropathy patients. And then as you build up that part of the business, a few months later, we add the decompression table to your practice. So it's a double niche way to inject a whole bunch of new business into your practice, and more importantly, give you a whole bunch of new things that you can do for patients that haven't found solutions anywhere else. Thank you so much for watching. I hope this has encapsulated everything for everybody watching. I hope to be able to help patients. I hope to be able to help doctors, and we want to help doctors help more patients. That's how this thing grows. That's how we help people all over the planet. And mission, that's it right there. Thanks so much for watching. Look forward to hearing from many of you soon.